Hi guys, I'm here today with Paediatric Psychologist and mum Amanda Abel to discuss how growth and developmental milestones affect sleep and settling in the toddler and preschooler years. Amanda's here today to give us parents a better understanding of what could be causing challenges around bedtime, overnight sleeping in 2 to 4-year-olds, and give us some really helpful, practical advice on how we can easily manage the bedtime. So Amanda, as a parent of a 4-year-old and a 7-year-old, I think I can confidently say 100% of parents of toddlers and preschoolers have had trouble at bedtime. What would an approach to bedtime look like for a toddler or preschooler to help your child work through those kinds of feelings or energy levels as we get closer to bedtime?
Yeah, so we definitely want the lead up to bedtime to be as calm as possible. Mm-hmm. So we'll always recommend that screens are, put away or shut down at least 2 hours before bedtime.
Okay, 2 hours, that's handy.
We don't want to have too much sort of mental stimulation going on. Mm-hmm. So just creating a calm environment as much as possible. I mean, families are families, and sometimes one parent might be coming home in the middle of the lead up to bed, but that if as much as we can have the calmness, that's what we're aiming for, and predictability. So we want to have a situation where the child knows what's coming up next. Mm-hmm. So they know that after dinner it might be bath time and, so on with their nighttime routine. And because these kinds of factors, the calmness, the predictability, that consistency just provides them that sense of security.
So I know my kids often struggle to go from playtime to bedtime routine time. What are some tips you can give parents in getting out of the play zone and into the bedtime zone?
Yes, it's so hard. And it happens at so many points throughout the day as well, doesn't it? Trying to get the kids to the dinner table for meals. Mm-hmm. It's such a big transition. And the bedtime one's so hard because they're so tired at that point as well. And it's very hard to stop whatever really fun activity you're doing and sort of start that nighttime routine. So I often would recommend for families to think about a nice transition activity. So that might be something that isn't as exciting as maybe what they're transitioning from, but it might be a bit calm, and it might be something that is still a bit motivating for the child to do, and it might lead nicely into, say, going off to have a bath or however they might be kicking off their nighttime routine. So some good activities would be things like, colouring in or puzzles, just things that might be low stimulation, so nothing exciting, obviously nothing screen-based, but something that might require just some slower movements, but still be fun and motivating, because then I guess we really want them to be able to easily transition to the next step, and you don't want to have something too fun because then you're just going to have the same problem again. Yes. They're not going to want to transition away from the puzzle or whatever it might be. So just something that might be that sort of step down that will still be engaging but calm them, kind of serve a few purposes really. Mm-hmm.
And once we get into the bedtime routine, what are the typical activities that are appropriate in a bedtime routine for this age group?
Generally, we would be looking at transitioning into bath time. There might be some play, happening with bath time. And after that, then we're obviously going to be doing things like brushing out teeth, getting pajamas on. And that's a really good time for kids to kind of feel a bit independent. Yes. So you can kind of encourage them to have a go at doing a bit of it by themselves if they're up for that. If they're exhausted at the end of the day and that's going to be pushing it too far, that's fine. Mm-hmm. Just read your child and see what they're capable of. But getting the jammies on and then sitting down and having some time together as well. I think it's like such a nice opportunity if the parent's in the right frame of mind to sit down and spend some time with your child, and again keeping it slow and calm, and maybe it's reading a book or doing some really quiet talking together at that point in time, just to kind of get that mood down nice and calm for the bed. And then once, you sort of said goodnight, it's sort of tucking the child in and just trying to exit the room nice and calmly and easily, and it not being sort of a big fanfare around it as well. So just allowing the child to sort of have that time by themselves.
Is it a good idea to verbalize some expectations around the routine? So, reminders every night we only have 2 books, or reminder that once mummy or daddy tucks you in, we have 1 kiss and cuddle. Is it good to continually talk them through that as well and remind them?
Yeah, it's really helpful. And it can be something that gets spoken about earlier on as well. So it might be a conversation that, you feel like you need to have because, you read one story to your child and then they keep asking for more and more and more. And so maybe earlier on in the evening you might explain, well, do you want to go and pick out the book that we're going to read tonight at bedtime? Go and pop that on your bed. We're just doing 1 book tonight. So go and pop that out and then, that'll be ready for us later on. And then again, you might reiterate that during the routine as it's happening as well. And if it's something like, wanting lots of kisses and cuddles and things like that, again, it might be just giving your child that feedback and also acknowledging what you think they might be experiencing. So, why might they be asking for lots of cuddles, or why might they be asking for more books? And there might be different reasons. They might be asking for more books because they're, avoiding it and they don't want to go to sleep immediately. Maybe they're wanting lots of cuddles because they're, maybe feeling a bit insecure.
Yeah, so had a bad day.
Had a bad day, want a bit of a cuddle. So it might, be acknowledging that back. Oh, I can see that you want to have lots of cuddles. I wish we could have heaps of cuddles, but remember we said only 1 cuddle tonight and, we can have lots of cuddles tomorrow morning. So, and really acknowledging and validating how they might be feeling. So, you must be feeling, you've had a really big day. You must be feeling really tired and maybe you're feeling a little bit, it's sad to see me walk out the door and that's okay, but let's have our cuddle and
I'll
see you again in the morning.
Yes.
And not before.
And do you have any tips for when a child starts to play up in that routine? So, they've been brushing their teeth every night after bath, but suddenly brushing teeth is off limits. They won't want to brush their teeth, even though that's a regular part of their routine. How can parents get through that?
Yeah. And we do see that because this is that age group where they're getting more independent. So we will start to see them kind of pushing back a little bit.
Yes.
It is a time though where we do want to start to give a bit more control to our kids, right?
Yeah.
So while we don't want to give them open-ended, free reign over everything that they're doing, it could be a little sign that, oh, my child seems to be maybe wanting a bit more control or independence. Maybe I could start to give them the choice between, do you want to do bath first or teeth first?
Okay.
So sometimes giving that choice of 2 can be really helpful. Giving the child a little bit of a sense of control can actually help them sort of just feel a bit more empowered in that situation. And often that's what they're trying to achieve when they are starting to resist that little bit.
So my 4-year-old has recently been saying at bedtime, I'm scared, I don't want to be by myself. And we've never experienced that from her at bedtime before. So in my mind, I'm thinking, she's just being manipulative because she wants me to stay in the bedroom longer. But is that an example?
It totally can be. So it can also be testing the boundaries a little bit. But it definitely can be that experience of, having those emotions and not maybe knowing how to regulate them. They're just little, they're not that independent in terms of managing their feelings and knowing how to, communicate about them. And often we won't hear about it during the day because they're busy, they're so active, for all of those, developmental reasons. And then we do hear about it at night time. Often I kind of feel like if it's a huge problem or a really big worry, you probably would have heard about it earlier in the day. And I always kind of say to parents, you don't necessarily need to sit down and have that big conversation about the emotions and the worries at that point in time because that's just going to make bedtime more difficult. So, but yeah, it definitely can be, it can be a genuine concern that your child might have.
It's very easy to get frustrated as a parent when you see those behaviours, those emotions coming up at bedtime that you're not necessarily seeing during the day, and it all seems to come to a head at bedtime.
It does. And because I guess like even for adults, you know, that moment when you go and lie down in bed, your, you know, mind might start to wander a bit and it might just kind of go to some of the worries or something, you know, not so positive that happened that day.
Yes.
And kids are the same. So often it's that really the only time that they're really alone and they have their thoughts. And that you might start to see some little worries coming out and some big feelings.
So can you tell us what is a 2 to 4 year old going through developmentally that might be causing those challenges at bedtime?
Well, it's such a big time for them because up until 5 is sort of the biggest period of brain growth in kids. So there's so much development going on in this period of time. So, you know, we're seeing the language development taking off, you know, the social skills, they're starting to play. That older age, you know, of that age range, they're starting to form little friendships. There's so much happening for them from a developmental perspective. So, you know, in terms of what's happening with their sleep and that kind of thing, we're then seeing obviously that there's big changes there as well. And like you said, like a lot of parents would find it a tricky time with sleep.
Yes.
My recommendation is normally around kind of work out what the problem is so that you can try to put some proactive strategies in place to prevent it from happening. You know, sometimes that can take a while, but for the parents to be able to get through those moments, a lot of the time it can be around like positively reframing the situation.
Okay.
So, you know, instead of thinking, oh my gosh, I'm going to be sitting here in my son's room for 5 hours tonight, this is going to be a nightmare, I've got so much stuff I need to get done, that's just going to make us more stressed.
Yes.
And then our kids pick up on our stress.
Okay.
So then we're likely going to be in there for a bit longer. So a positive reframe might be something like, you know, well, I do have things to do. I'm just going to try and stay calm, enjoy this time with my child, and you know, it's another opportunity for us to practice this together, or something a little bit positive can kind of just help the parents get through it.
Yes, absolutely.
If there's 2 parents, it can be really helpful to talk about, you know, tag teaming it, who's responsible for what. If one parent's feeling a bit depleted, maybe it's the other parent's, you know, chance to step up and have a go.
Yes.
So that can kind of just help the parents get through those moments as well.
Yeah.
But definitely the things like the nighttime routine and having those really clear rituals, I feel like that actually helps the parents as well as the kids, because it gives the parents just that timeline of what we've got to get through. You don't have to think about it because you're doing the same thing every night. So that can be kind of relatively helpful.
And is it helpful when you have grandma or granddad or babysitters that they're aware of the routines as well and that they keep that consistency going if you're not the one putting them down for bed?
Yeah, ideally. I don't know how often it happens, but it is really helpful because from the child's perspective, there can end up being too much change. So if the parents have gone out and now we've got a babysitter or a grandparent looking after them, and then we've got one aspect of change. You know, my environment's different now. My parents aren't here. Someone else is looking after me. And then if that person does a whole different routine, that's a whole nother layer of change as well. And that can just become really unsettling for kids, especially at the end of the day when they're really tired and they're far less resilient. So if extra carers can be across the general routine, it is always helpful. You know, it's not going to be the end of the world if, you know, once a month, you know, grandma's putting the child down to bed and, you know, she spends a bit longer in there doing stories, which is basically what used to happen in my house. It's not the end of the world. But I suppose in situations, if there are some kind of really clinical sleep problems, then it would be really important for it to be really regimented.
Earlier we were talking about consequences and teaching consequences for behaviour. Is the bedtime routine appropriate or not appropriate to be discussing consequences. So, if they're playing up, they don't want to brush teeth or they won't get out of the bath, can we introduce consequences like, well, then we can't have 2 stories, we can only have 1? Or is this an appropriate time to be doing that, or should we keep that to another time of the day?
I think it depends on the family and on the child and the situation. So in some situations, you might be able to do that and it might work okay. In other situations, applying a consequence at that point in the night when the child's already tired and they're already upset because now they haven't been allowed to whatever it was, not brush their teeth or whatever. And now we're applying a consequence. It's probably going to make it harder for them to go to sleep.
Okay.
So if we're sort of saying, oh, you can't have an extra story because you wouldn't brush your teeth before, there's probably a pretty big chance they'll get heightened, and then we're probably expecting too much for them to be able to calm down and fall asleep independently.
Okay.
So I would recommend applying consequences and look more on the side of rewards, but I'd be applying them the next morning.
Okay.
So things like, if you can go straight to sleep tonight, maybe you could choose a special breakfast to have, tomorrow morning from the special boxes of cereal we've got. So thinking about it in a positive light rather than sort of removing their privileges and things like that.
So let's chat about that, about the resilience levels at bedtime, the emotions at bedtime. What is something we as parents can do to help them process that emotion at the end of the day and help them wind down and get into a more settled mind frame?
It's a really good question, actually. And, maybe something that could be factored into the transition activities or the quiet sort of, story time period right before bed might be things that focus on the emotions and the child's kind of perception of themselves and their self-esteem. Some really positive things that can then set them up for a really sort of in a nice place for sleep, I guess. Things like affirmations, can be so nice and positive to go through, with younger kids, and people might sort of think, oh, they're too young, like how are they going to understand these? But really it's about giving them that opportunity to understand it and open up some conversations that, I can say positive things about myself and, that's probably going to change how I feel. So it's really, giving them that opportunity to be in control of their emotions a little bit more. They're not going to walk away sprouting affirmations, 24/7, but it is part of that learning process.
Yes.
So it can be a really lovely way to sort of, introduce it to them.
And we spoke a little bit earlier about children who might be worried about certain things at bedtime. Does something like an affirmation help change that narrative in their head? Is it switching gears for them?
Yeah, it can be so helpful. Yeah, and like you say, particularly if it's something that is relating to the bedtime, like I don't want to be in the room by myself, or I don't want, mum to leave the room. It really can help with that kind of thing because it's giving them, I guess, that chance to express it, reframe it, think about what strengths they've got that can help them get through it as well. And having that conversation with your child really can, I guess, provide a bit of a narrative for, what bedtime can be. So it doesn't have to be, I'm scared of being by myself at night. It can be, sleep helps me feel confident tomorrow, or it can really be about showing them that you can actually change that outcome.
Yes. Yeah, absolutely. Yeah, I really love that. And for the parents as well to have or to reframe bedtime, which can be so stressful, and like you said, they're tired and you just want your kids to go to sleep so you can have some time to yourself. I guess in a way that helps the parents as well to give them some coping strategies about reframing.
So, I might be practicing mindfulness or relaxation, with my child, and, I might actually reap some of the benefits from that. And it's kind of the same with things, like affirmations, that if we're going through that with our child and thinking about those positive statements, that we'll probably start to benefit a little bit from that as well. And then that can help us get through the rest of the evening.
Yes, absolutely. So earlier you mentioned seeing a child and acknowledging their emotions can be quite helpful for them. So, you know, the example of, I can see you've had a bad day, or, you know, you feel quite upset, and that's okay. How can affirmations help in that sense?
Yeah. I feel like they give, you know, I guess it's a chance to acknowledge what's going on for the child in their life. And, you know, practicing or talking about affirmations, you know, say in those little isolated experiences like bedtime, it's giving the child then a chance to maybe be able to utilise those phrases at other times as well. So it might be, you know, I love my body at night time. That's what we're talking about. That's, you know, the affirmation that we might have chosen to focus on. And then that might be really helpful tomorrow when, you know, their friend has won the running race, you know, at childcare.
Yes.
And, you know, might be really down on themselves. And then, you know, maybe having that reminder that actually remember you love your body and does a lot of positive things for you. So it can kind of open up conversations that can really help kids to have that positive thinking style.
Doesn't matter what time they're going to bed. How much sleep does a toddler or preschooler really need?
So, I mean, look, I guess it probably doesn't matter exactly what time they're going to bed. I suppose what is important is the amount of hours that they're having and that ritual in the lead up to bedtime, right? So in terms of hours, we're looking at sort of between 11 and 14 hours for the younger age groups, so your toddlers, and that would probably include 1 or 2 day naps as well. Yep. So that's a nice big chunk of sleep. And then probably, I think, 10 to 13 hours we would expect for your preschoolers.
Yep.
They might start to be dropping a day's sleep around that time. So you might then replace that with just some quiet time, because they will still need that time to recharge and just sort of have a bit of downtime, reset their little bodies and brains.
Yeah, okay. So not necessarily bedtime by 7 p.m, but more that we're getting the hours that we need and that we keep the ritual and the routine consistent over whatever time period that is.
Definitely. And look, I mean, I think most families you'll find bedtime tends to be somewhere between, you know, 6 and 8 or something like that, because to get the right amount of sleep in time to wake up the next day for older kids to go to school or the younger ones to be at preschool, you know, you're kind of going to have to fit your sleeping hours in that way. Yeah. So, but certainly, you know, it's not so much about being really by the clock, but more about the ritual and the process and just making sure we've got enough of that actual sleep hours and that it's quality sleep as well.
Can you give us some tips around how overnight waking, coming into the parents' bed, we hear this one a lot. I've been through it with my own kids. So we've got them down to sleep, but how are we managing this overnight waking and wanting to be sleeping in the parents' bed and not their own bed?
Yes, it's so hard. And especially when you're tired in the middle of the night, you're not always resilient enough yourself to be able to manage the situation. So if you're starting to notice that it's happening, I suggest that parents develop a bit of a plan, obviously outside of the moment. So the next day maybe sitting down and just thinking about, well, what are our options? Who's going to manage this? You know, maybe there's a roster, who knows? And it might then be around the parent, you know, let's say the child's coming into the parent's room and the recommendation is really to take the child back to their bed.
Okay.
And, you know, help resettle them independently, you know, as much as they can, and, you know, to basically just keep doing that.
Okay.
So, you know, keep taking them back and forth and not making it obviously a horrible experience for them and not being mean to them or anything like that, but also not making it a really positive experience where, you know,
it's fun.
We're having heaps of cuddles and all that kind of thing. So it's really just about getting back into bed and try not to make it too stimulating, because I think that's the other thing. Some parents might really start up a conversation with the child and then now the child's really awake and it's much harder for them to fall back to sleep.
Yes.
So just trying again to keep it calm, like in that lead up to bedtime, calm voices, keeping everything calm, not much conversation, and just trying to get them back into their bed.
And what about night terrors? How can a parent manage something that can be quite confronting when you're in it? What age do night terrors typically happen? Do kids grow out of them? What can parents do to help get through it?
There's not a massive amount known about night terrors because obviously, we can't do a huge amount of research in that really young population.
Yes.
So, but we do see it in the young toddlers, and even sometimes, in younger, in babies, where it really appears like they're having these night terrors, and it's quite scary for parents. So I think the thing for parents to understand is that your child's still asleep, and it does look like they're, having some sort of, horrendous experience, but you work out quite quickly that they're not responding to you. So they are dreaming, and it's really about kind of keeping them safe and taking them back to bed if they're moving around. There have been some success stories where kids that have sort of regular night terrors at a certain time every night, which is often what happens because it can be at a certain point of the sleep cycle.
Yes.
So what can be recommended is to wake them up sort of just before that happen, that point in the sleep cycle, and that tends to make them sort of disappear a little bit.
Okay.
So that can kind of be pretty helpful.
When the child is in the midst of the night terror, should the parents be trying to wake them or just let it naturally come to an end?
Yeah, let it run its course, and, just I think the main thing is keeping the child safe. If they're moving around a lot and they're in that state, it's easy to trip over things or bang into things. So, getting them back into their bed and letting it kind of run its course. And they can certainly, comfort the child as needed, but just sort of not be too invasive, because kids can then get a really big shock as well if they wake up and, they've got their parent there and it's really unexpected. So trying to sort of just keep everything really calm and not too, I guess, in your face for them. Yeah.
And do kids grow out of night terrors? Is it?
They can. So I from the research I've done into them, it tends to be certainly related to the sleep cycle and certain points in the sleep cycle. And we definitely see kind of less of them as kids get older. But some children might continue to have those sort of disruptions in their sleep as they get older. But, it's certainly something that we would see more in that younger age group, and just becomes sort of less frequent as they get older.
Now, overnight bedwetting. It's, I guess, an interesting one. I think there are some theories around whether it's a physiological thing or a developmental psychological thing. Could you give us some insight into what might be causing overnight bedwetting in the 3 and 4 year old age group?
Yeah. Well, from a developmental perspective, it's kind of appropriate to be having night bedwetting up until they're sort of 5 or 6 years old. So, and that's largely physiological, sort of hormonal growth, all of those kinds of factors. So in terms of whether or not it's appropriate, it's fine.
Great.
It's expected. Kids will have accidents. So I guess there is that sort of physiological side of it. We do see when kids are struggling with their emotions, or if they've been, in some sort of traumatic situation or high stress, that we might start to see a regression in toileting. So we could definitely see accidents during the day. We could see bedwetting at nighttime. And if parents are concerned about that, and the child had already mastered that skill and everything was fine, that's an opportunity then to kind of monitor that a little bit, and then maybe have a chat to your doctor or your paediatrician about, is there something going on here? Sometimes there can be really unusual things causing it, like, if a child might have constipation, we might start to see some problems like bedwetting and having accidents during the day. and we wouldn't normally make that connection ourselves as parents. So sometimes there could be a whole heap of other potential explanations. But as the parents, we might be thinking, oh my gosh, my child's been traumatized, there's something going wrong, and now they're having accidents at night. But it's, it may well be something really straightforward that's easy to treat, and, everyone can sort of not have to be too stressed about the outcomes with it.
Okay, yes. And I've noticed with my daughter, she seems to wet the bed more. She's had a bigger day. She's more tired. She can't wake herself up to 100%. Use the bathroom, which we've noticed is another, quite simple.
Yes.
So we might just wake her up and take her to the bathroom. Is that okay to wake a child, take them during the sleep cycle?
Yeah, and another thing is we'll often see kids not wanting to go if it's too cold. So they don't want to get out of bed, and, same thing, they might be really sleepy, they're not fully sort of cognizant of what they're doing, and if the room is too cold, they won't hop out of bed and go to the bathroom at night time. And simple fixes might be popping a heater on in the room or, keeping things a little warmer.
Well, you've given us some great tidbits today. Can you offer any final advice for parents out there of 2 to 4-year-olds with their nighttime challenges?
Look, I think it's so important that parents don't put too much pressure on themselves and on their kids in those years where things are really difficult. And really to understand what's normal for that age. It is normal to have difficulties with sleep. Your kids are becoming more independent. They're going to assert themselves more. They're going to have worries during the day. They're still learning how to regulate their emotions. And all of this can explode like a bit of a volcano at 5 or 6 o'clock at night time. And that is totally to be expected. The problems will start arising if we want everything to be perfect.
Okay.
And, we always talk about, for parenting, it's not about being perfect. It's really about just doing your best and thinking about what your child needs from you, what you can give. And, it's not about doing the right thing 100% of the time, because no one can do that.
Absolutely. That's great advice. Thank you so much. We really appreciate your time, and I'm sure all of our parents out there really appreciate the advice you've given today. So thanks for joining us, Amanda.
Thank you so much for having me.